performing their normal duties, as well as attempting to administer the first aid. The fire service plays an invaluable role in ensuring the accident is safe from fire and in extracting casualties who may be trapped in the wreckage. They also have excellent first aid skills. The ambulance itself arrives at the scene with a locally employed driver and 2 medics. The ambulance is equipped to deal with casualties with any form of major trauma. The initial priorities of the medics is to make a rapid assessment of the condition and number of casualties and decide whether extra help is needed. Corporal Game has gone to the casualty who appears to be most seriously injured in the white car, and Corporal Ritalik, who is the X-ray technician by day, to the casualty who appears to be sunbathing on the bonnet of the blue car. Having rapidly assessed her patient, she asks the ambulance driver to monitor him while she returns to the ambulance to call for the duty doctor. Having done that, she returns to her casualty to continue treatment. Meanwhile, if our attention returns to Corporal Game at the white car, we will see how a casualty is resuscitated and retrieved from a vehicle. Corporal Game will initially perform a primary survey. This involves a systematic check of the casualty's basic life support systems, based on the Advanced Trauma Life Support System. Firstly, he checks the patient's airway, removes any false teeth, and sucks out any debris or vomit from the mouth. He also stabilises the casualty's neck, as cervical spine injuries are not uncommon in an accident of this nature, particularly when there are injuries above the level of the collarbones, and also if any occupants have been ejected from inside the vehicle. After checking the airway, Corporal Game assesses whether the casualty is breathing by looking at his colour and chest movements, listening for breathing, feeling the rise and fall of the chest, and feeling for exhaled air. He then checks the pulse and controls any obvious life-threatening hemorrhage. Corporal Ritalik, who is working on the casualty in the blue car, has also performed a primary survey and is ready to perform the secondary survey. This is a systematic examination of the casualty's body from head to toe, which enables the medic to identify any obvious injuries and treat them in priority. She will look at the patient's head and face, while at the same time maintaining the neck in a stable position. She will then examine the chest for obvious injury. Then she moves on to the abdomen. "Oh dear," she says to herself, "I think he spilt his guts all over the bonnet." Corporal Ritalik fights back the waves of nausea, as there is a sizable crowd now gathering, watching everything she does. She carries on in a professional manner to examine the rest of the casualty, including his legs, back and arms. Corporal Ritalik now carries on with the appropriate treatment. In the meantime, Corporal Game at the white car has decided to insert a drip in his patient. This is because the patient is complaining of chest pain. This started before the crash occurred, and it may well be that this man has suffered from a heart attack leading to the accident. Setting up a drip is not always a straightforward procedure, even under ideal conditions. In a situation such as this, it may well be necessary to do it before removing the casualty from the vehicle, and this provides the complication of working in a cramped, confined space. Added to this, it may well be dark or raining, and all these factors may combine to make the procedure very difficult. To insert a drip, a tourniquet is applied around the upper arm. Then a bottle of fluid is run through a giving set. Next, a suitable vein has to be identified. Corporal Game will then attempt to insert the needle or cannula into a vein. This is not always successful first time, so several attempts may be needed. Once the cannula is in place, the bottle of fluid and giving set are attached. This then needs to be secured in place with tape and a splint. Fortunately, as you can see, the duty doctor has arrived. The duty doctor today is Major Alan Kerr, the RMO for 9 Signal Regiment. He is equipped with an identical set of equipment for treating casualties who have suffered from major trauma. He also carries a selection of drugs for the treatment of these casualties and a heart start machine, which is a portable heart monitor and defibrillator. If this was a more serious accident, for example a coach crash, then a larger amount of equipment would be needed. You will notice this being set up in the background, and I will come back to this later. doctor has got an update on the situation and what has been done so far, and his attention turns to the casualty who appears to be in the worst condition. If at any stage a casualty starts to deteriorate, the medic will repeat his primary survey to recheck the airway, breathing. He has a blocked airway, but in this case it is a bit more serious. He has had a cardiac arrest and requires immediate attention. Corporal Game gets assistance. The casualty is rapidly but carefully removed from the vehicle. Whilst Corporal Game exposes the chest, Corporal Retallick clears the casualty's airway and starts to breathe for him via a bag and mask. In the meantime, Corporal Game starts external cardiac compression. The doctor takes charge of the situation in this instance, as these three individuals now need to work as a coordinated team. He attaches a heart start machine to the patient's chest. To perform effective cardiopulmonary resuscitation, the team goes through a set procedure. This involves giving one ventilation for every 5 compressions of the heart. Then a series of shocks will be given to try to restart the heart, and adrenaline given through the drip at set intervals. You might ask how often the ambulance is asked to attend an incident like this. Every month there are about 6 to 8 major accidents with patients with significant injuries, and many less serious accidents that the ambulance is required to attend. This usually reaches a peak in the summer months. The casualties may be members of the forces, from the local population or tourists. There were 9 deaths on the roads of the Esba last year, and numerous casualties with major injuries. None of the casualties picked up by the medics alive from a road traffic accident has died on the way to hospital in the last year. The team of 3 still working on the casualty from the white car carry on with their routine. Usually, a prolonged period of time will be tried of resuscitation. Having said that, the man in the white car may be our first death in the last year, as the resuscitation attempt appears to have been unsuccessful. The doctor monitors the progress of the resuscitation and finally decides that it is beyond hope and there is no chance of reviving the patient.